Adult cardiac arrest is a time-critical emergency. The most common cause is sudden cardiac arrhythmia, often related to underlying heart disease. Immediate action, calling for help, starting CPR and using an AED gives the best chance of survival. Before approaching, always ensure the area is safe. Look for traffic, fire, electricity, or any other dangers that could harm you or the casualty. Approach the person, speak loudly and clearly. "Hello, my name's Keith, I'm a first aider. Can you hear me?" Gently shake their shoulders and ask, "Are you okay?" If there's no response, shout for help. If someone is nearby, ask them to call 999 immediately. Put the phone on speakerphone and bring an AED if one's available. If you're alone, use your mobile phone on speakerphone to call 999 so the operator can guide you through CPR. The emergency call handler will give step-by-step instructions. Next, quickly assess for normal breathing. Open the airway with a head tilt, chin lift. Place one hand on the forehead and 2 fingers under the chin and gently tilt the head back. Look into the mouth, remove any visible obstruction, only if it can be seen and easily removed. With the airway open, look, listen and feel for normal breathing for no more than 10 seconds. You're looking for the chest to rise and fall, listening for breath sounds and feeling for air on your cheek. If the casualty is not breathing normally or is only gasping, assume cardiac arrest and begin CPR immediately. If an AED is nearby, ask someone to fetch it straight away. Do not leave the casualty to search for one unless you're alone and an AED is very close. Begin CPR without delay. Kneel beside the casualty's chest. Place the heel of one hand on the center of the chest, on the lower half of the sternum. Place the other hand on top, interlocking your fingers, and keep your arms straight with your shoulders directly above your hands. Press down firmly to a depth of 5 to 6 centimeters. Release completely after each compression to allow the chest to rise, but don't lift your hands off the chest. Continue compressions at a rate of 100 to 120 per minute, which is about 2 per second. After the 30 compressions, reopen the airway with the head tilt, chin lift. Pinch the nose closed, seal your mouth over theirs, and blow steadily for about 1 second. Watch for the chest to rise. Allow it to fall before giving the second breath, then return immediately to chest compressions. If you're unwilling or unable to give rescue breaths, continue with chest compressions only. These are still highly effective and strongly recommended. As soon as the AED arrives, switch it on immediately. Most units give clear voice instructions. Expose the chest by cutting away clothing. This includes cutting away a bra if necessary. Attach the pads exactly as shown on the diagrams. One just below the patient's right collarbone, the other on the left side just below the armpit. Ensure no one is touching the casualty. The AED will analyze the heart rhythm during this step. If shock is advised, ensure everyone is clear, say "stand clear" and press the shock button. Immediately resume CPR after the shock, starting with chest compressions. If no shock is advised, continue CPR with 30 compressions and 2 breaths. Keep performing CPR until the person starts breathing normally or shows signs of life, such as movement, eye opening, or coughing. Emergency services arrive and take over, or you become too exhausted to continue. If the person begins to breathe normally, place them in a recovery position, keeping the airway open and monitor their breathing continually until help arrives. The key points to remember are: check for safety before approaching, call 999 early and put your phone on speaker, begin CPR immediately if the casualty is unresponsive and not breathing normally, perform 30 compressions, 2 breaths, compressing 5 to 6 centimeters at 100 to 120 per minute, use an AED as soon as possible and follow the voice instructions. And if you cannot give breaths, perform continual chest compressions until help arrives.